Hey everyone, and welcome to my channel. Today, we're diving into the world of medical imaging and exploring a powerful tool doctors use to see inside our bodies, the MRI scan. Magnetic resonance imaging, MRI, is a medical imaging technique that uses a magnetic strong field and computer-generated radio waves to create detailed images of the organs and tissues in your body. MRI can help with viewing injuries, tumors, certain heart problems, and more. The MRI machine also can produce 3D images that can be viewed from different angles. MRI is a non-invasive way for a medical professional to examine your organs, tissues and skeletal system. It produces high-resolution images of the inside of the body. An MRI scan can be used as an extremely accurate method of disease detection throughout the body and is most often used after the other testing fails to provide sufficient information to confirm a patient's diagnosis. Some MRI machines look like narrow tunnels, while others are more open. Most MRI machines are large, tube-shaped magnets. When you lie inside an MRI machine, the magnetic field inside works with radio waves and hydrogen atoms in your body to create cross-sectional images, like slices in a loaf of bread. The MRI machine also can produce 3D images that can be viewed from different angles. An MRI scan is usually painless. You'll lie down on a table that slides into a large, tube-shaped machine. The machine might make loud knocking noises during the scan, but headphones with calming music are usually provided. It's important to stay very still to get clear images. MRI employ a strong magnetic field. The magnetic field extends beyond the machine and exerts very powerful forces on objects of iron, some steels, and other magnetizable objects. Nothing metal or electronic is allowed inside MRI room. Patients are required to change into MRI-safe clothing. Mr. Safety. Patients are required to bring medical implant cards. If the patient feels uncomfortable during the procedure, they can speak to the MRI technician via the intercom and request that the scan be stopped. After the scan, the radiologist will examine the images to check whether any more are required. If the radiologist is satisfied, the patient can go home. The radiologist will prepare a report for the requesting doctor. Patients are usually asked to make an appointment with their doctor to discuss the results. It is extremely rare that a patient will experience side effects from an MRI scan. However, individuals with kidney disease and those who are pregnant should let the doctor know before getting an MRI with contrast. The contrast dye can cause nausea, headaches, and pain or burning at the point of injection in some people. Notify the technician if any adverse reactions occur. So, there you have it. MRIs are a valuable tool in modern medicine, offering a safe and detailed view inside our bodies. If you have any questions about MRIs or are scheduled for one yourself, be sure to talk to your doctor. Thanks for joining me today. Don't forget to like and subscribe for more explorations into the fascinating world of health and science.